Good morning, everybody. Welcome back to those of you who were with us yesterday. And I'm delighted to be able to join in this session and to perhaps contribute to the panel discussion later on by contributing some reflections from a national funders perspective. I think, like everybody else, the HRB was responding to what it found unveiling before. So we needed to be flexible, we needed to be responsive. I think, and I hope you will conclude by the end of it, that we were, and we continue to be, and we need to be. What helped us? Well, I think it was helpful that we had a really good and close relationship with our funder in the department, who in this instance was also the key, certainly in the first instance, and still a key decision-making organisation, certainly in terms of the public health decisions and the work of NEFIT. So that relationship stood us in good stead. I think you need to work well and candidly and with agility with other funders, and I think those relationships were in a good place. As we touched on yesterday, there's generally good cooperation and collaboration between the national funders. So that stood us in good stead. I suppose 2 points I would make, not in contrast to that, but certainly was challenging, was that wanting to respond will only take you so far. But much of a funder's income is pre-committed on multi-annual grants ahead for many years and across many things. And that's a struggle for a funder that gets 1 year funding at a time and only knows from 1 year to the next what it's getting. So the reality was that it was largely the small amount of discretionary funding, as it were, that hadn't already been committed. And you were redirecting your funding, whereas really what would have been desirable would have been additional funding in middle of a year, in the middle of the crisis. And that didn't happen. You were looking really to the next year in terms of looking for any additional funding. So there is a residual opportunity cost to that, and that will linger for quite a few years to come. Having said that, I think you're all aware, many of you applied to our rapid response calls that went out almost within weeks of the crisis arising, through the pre-call announcement and then the full call, using the WHO blueprint and the 3 strands as our kind of themes for that call. We co-funded the social countermeasures call with the Irish Research Council, which we were delighted about. Funded 36 projects, over 5 million invested in those. And I think that relationship really will continue to go from strength to strength and make sense. And we were really pleased with that. We also funded other projects through other initiatives, like our Research Collaborative in Quality and Patient Safety, where 4 dedicated COVID projects were run. And we also supported through our Horizon contact and delegate role, you to be aware of and participate in European Horizon calls, and Irish candidates were successful in that. We also responded in a slightly different way, but a really important way, to provide for the recommendation that was in the ethical framework for decision making in a pandemic, that you ideally have a centralised research ethics committee to look at COVID-19 projects in an expedited fashion. And literally within weeks, I'd say about 1 or 2 day old new national office that was being established in the HRB mobilised, and Jenny and the team mobilised in there really, really quick to have a national coordinated response for research ethics, and an NREC for COVID established and functional within weeks, and have approved almost 100 applications for COVID-19 projects. Important to say that really, really good cooperation between entities like the HPRA in relation to streamlining the trials part of the application process, the HRCDC leaning in from the data aspects of it, and support from the Department of Health, and support from local research ethics committees, and most of all, support from the research community, who unquestionably answered the call and agreed and accepted to participate on the NREC itself. So I think this was a real success, and I think a real proof of concept, if ever we needed one, that NRECs are definitely the way to go for multi-centre studies in Ireland. Our longitudinal studies really came into their own in the pandemic, with a real focus, and a badly needed focus, on vulnerable and populations disproportionately affected by the pandemic. These are powerful tools at the best of times for policy makings and to responding to things that happen around us, policy changes or otherwise. And just two examples here of the surveys of the older adults, community dwelling adults, and then older people with an intellectual disability in those surveys. And hopefully those surveys will be repeated again and will give us even more evidence. But really powerful and significant data and evidence coming through them, and again showing the value of longitudinal cohort studies in our research ecosystem. Another area that we worked very closely with the department on was in relation to trials of COVID-19 treatments. The department made a decision at the outset that it wanted its public investment in large multinational adaptive trials of COVID-19 treatments to achieve the statistical power, and we worked very closely with them on that, largely because of our prior investment in CRFs and other trial supports, and the department were aware of that, and I think again that has been a real success. Through Ireland is involved in the week MapCap, a trial in ICUs led by Alistair Nicholl, the WHO Solidarity trial led by Joe Eustace down in Cork and supported by CRCI, the prospective observational study Sprint Sari, again that Alistair has taken a lead on, with 17 sites participating in Ireland, and huge learning from all of those that I just don't have time to go into today, but really invaluable learning, and I think a great contribution from Ireland in this regard, and going from strength to strength with ECRA now, and as a lot of developments in Europe happening, including the EU Vaccine Network trial, now seeing Irish involvement in that, and thinking how we go to the next level and continue the footprint that we have demonstrated so far in this pandemic. So again, really great work there. And just putting this up, I suppose, to again for the conversation to go, scientific publishing is in a completely new place. It's completely reimagined. If you were to tell me that a year or two ago that over 64% of all publications are going to be in preprint ahead of peer review, I just wouldn't have believed you. And I think this is we're not going backwards. I don't think in this regard. But of course that does throw up challenges in relation to what is the trade-off, if I can call it that, between acceleration, transparency, quality, and reproducibility. So I think lots of discussions ahead of us on this issue. I think undoubtedly, we knew this anyway, but COVID has just shown us the future is open. And just a reminder of, I suppose, the COVID collection that's on the HRB's open research publishing platform there, but definitely the future is open. I think this is an area that I just wanted to mention, because I think Ireland just really punched really high up there and well above its weight in relation to evidence synthesis, feeding that into the national process, but also the whole work going on globally on optimising the use of existing and the rapidly evolving evidence and data, trial data, etc., that was coming through the systems. And again, this is another example of where when you've invested in networks, when you've invested in entities like Evidence Synthesis Ireland and Cochrane Ireland and TMRN for many years, there is a network, there is a resource, there is an ability to pivot, and that's exactly what this group did. They pooled their collective resources. They formed this entity called the Emergency Evidence Response Service, and they basically, not to put too fine a point on it, they churned out rapid reviews, evidence reviews, updated reviews that were being, importantly, were those that were being prioritised at the international level. They worked with lots of other similar evidence synthesis centres globally, like EPI, McMaster in Canada, and so on. And they linked in with the Cochrane Library Global in terms of their special collections, the rapid collections. They contributed a huge number of reviews to the World Health Organization update of the clinical management guidelines. They contributed to Evidence Aid, and they participated in this really, I think, very exciting initiative, and is really something that is a sort of a sign of things to come, COVID NMA, which is an open living mapping of a living evidence synthesis to inform decision making. If you haven't gone into this website, you really should, and you should take a look at it. It proved invaluable, and is proving invaluable for decision making, linking into NEFID and into the department and so on, and used by HICWA to do kind of HTAs and assessments of trial evidence, and constantly supply that insight into the department. Used by the WHO. It's really used, by just so many decision makers, including, going back to those trials I mentioned earlier, the trial steering committees who are trying to figure out what the evidence is, what's emerging, staying abreast of that, what new treatment arms to introduce, etc. Like I said, this is really a sign of things to come, and it's daunting. It's weekly searches, it's weekly updates by hundreds of people all around the globe. So how do you coordinate that? How do you sustain that? How do we take this forward? And how do we as national funders try to contribute to that? And some really challenging but really exciting questions to think about into the future. But a fantastic resource, and delighted for Ireland to be such an integral part of this activity. Just wanted to include a slide on misinformation, conspiracy theories, and so on, following on from the theme of the HRB conference last year around, trust in research and transparency and so on, and that whole issue of fake news, misinformation, and so on. And we really see this during the COVID pandemic. And so this is an area that the HRB is really interested in building a research agenda and learning more about into the future. I think it builds very nicely on both our evidence synthesis investments on the one hand, and also our public and patient involvement, and our citizen engagement piece. And so I held facts, which was initiated out of Galway with the support of ESI and Cochrane and TMRN, and the HRB contributed in a small way to this, is really about enabling the public in a quick and an easy and an accessible way to ask questions, also engage with that and start to understand and take ownership of how that evidence can inform their own decisions. So very exciting initiative, and is definitely hitting on an area that I think we will all continue to talk about, and we need to think about interventions in this space, both nationally and globally. Just wanted to say a little bit about some current developments. So things really, I suppose, in the last number of months, not back as far as March and so on. They're often things that we've been talking about for a long time, but in reality, because of that issue around funding and not having additional funding for a large chunk of 2020 to be able to do these things, pleased to say that through our discussions in terms of 2021 funding with the department, we have been able to initiate a process at least to get an application in to, and it's under review at present, so I'm not going to say very much about it, but to establish a national COVID-19 biobank, and that's important in its own right, and it's badly needed and will make a huge difference. But they're also, we would very much see it as the start of an investment in this space of underinvestment, and as we discussed yesterday in the innovation infrastructures section, absolutely key to a lot of the issues like omics, personalised medicine, cancer, etc., that was mentioned in there. So that's an exciting development currently. Hopefully next week, early stage of next week, all going well, fingers crossed, we will, with the CSO and the department, the HRB will be announcing and opening a process whereby researchers can seek access to patient level detail in the COVID-19 data portal for research purposes. And so lots more about that, and I'm not going to spend too much time because we spent a lot of time yesterday talking about secondary use of data, but a really exciting initiative for us. We're also in discussions with the Department of Health about establishing a structured PhD training programme for public health modelling, to build our medium-term capacity in this space where we can have maths and stats and geographers and epidemiologists and other healthcare professionals working together in this space. I think that was a need that was clearly identified throughout the process. And again, I won't say much about this because we talked about it yesterday, but we're again working with the department and the HSC and linking into a new initiative in Europe called Population Health Information Research Infrastructure, which is very much about how do you set yourself up for sharing population health data in this instance safely and securely for research and for decision making, for surveillance and for policy purposes in Europe. So again, lots of learning to come from that. Before I wrap up, I just can't not comment on the issue that is concerning all of you in terms of uncertainty and so on. That is the impact of COVID-19 on all of your research grants. And I think I'd like to think that the HB responded very well initially by putting up FAQs, by engaging with you on that. We know that is the case because we've already approved over 70 no-cost extensions and budget allocation requests for you. We will continue to do that. The annual reports process is out. We will be looking and seeing what we can do to support you in that regard. And of course, I'd encourage you to engage with the HEA fund, which has been made available by government for those projects that require supplemental funding where staff or students otherwise would be have to cease their activity. So we're engaging deeply in that process with HEA and others, and we'd encourage you to do so. We know that HRB researchers have been funded already, and we hope many more will. I've touched on many of these issues already. We've learned a lot about funding models for the future. It is international, it is collaborative, and we need to build flexibility somehow into our funding models. As a funder, we found ourselves asking questions, do you wait to see what emerges? Or in time of pandemic, do you need to be more directive as required? Do you take positions on things where there is an urgent need? And I think we probably did a little bit of both. And I think on the conversation yesterday about administrative burden, I think we can all learn, and we will certainly be thinking about what we can take from rapid response research calls to bring into our normal processes. COVID exposed and exacerbated existing flaws in our health research system. That ain't going to surprise anybody. Biobanking, access to data, public health capacity, those issues came to the fore and need to be rectified. And I've put a provocative question in here towards the end, which is, it wasn't always clear, or did we not have a government lead for research coordination Very unsettling political times that this was happening in, but it wasn't clear. Was it the Department of Health? Was it the Department of Taoiseach? Was it the new department? Who was it? I think we probably could have done with that, and that's something for us to have a think about as we move into the future. In summary, and to wrap up and to move into the discussion from our grant holders, I think the HRB mobilised and was flexible. The research community mobilised. You mobilised, and you're still responding, which is just as well because the information gaps and the evidence needs persist. The pandemic requires solidarity, collaboration, and coordination. I hope that the HRB won't be found wanting in that. The future is open. PPI and public engagement and involvement is more important than ever, and we need to figure out how to tackle misinformation. We will continue to prioritise flexibility for all grant holders and welcome and encourage HRB grant holders to avail of the HEA fund to the greatest extent. And I can't but conclude by saying that probably the biggest reflection for me as Director of Research, Strategy and Funding in the HRB at this moment in time is public investment in research and investment needs to be prioritised. COVID RNI, non-COVID RNI, we need to increase public investment. Mairead showed yesterday that we're already lagging way behind, no matter what measure you do, in relation to funding for research in Ireland. So public investment in research and innovation and in health research needs to be prioritised. I look forward to the discussion later. Thank you.